driver is first to arrive.
It's probably one of the worst ones I've seen. The intrusion was so much that the driver was in the back seat. Normally, they would just take the roof off. Here, they had to literally cut small pieces of car away for us to even be able to access him to give him treatment.
You know where we are at the moment? Okay, fine.
We get this plug up and under pressure, please. Oh, it is coming down.
The trauma team rapidly assess Daniel.
Airway is clear, he's talking to me. He is on a collar, he's not complaining of any pain in his neck. He has paradoxical movement of his chest.
The team discover his most urgent life-threatening injury, damage to his chest and lungs, was brought under control at Colchester.
Over his right side of his chest, he has a chest sprain on the right side of his chest.
Daniel, I'm Ali, I'm one of the other doctors. Can you wiggle these toes for me? Yeah, move your toes. Alright. They're not at the moment. Yeah?
Yeah.
Try this one.
Your right one.
Left one's moving.
Right.
Okay.
Ali's main concern now is the damage to Daniel's spine.
Is it not on the left hand? Do you want me to do a bit of morphine loading?
His girlfriend, Louise, arrived with him. He managed to call her after the crash, and she rushed straight to the scene.
It was awful. Just mangled up mess with him stuck in it. He kept going like his eyes were shutting, and while they're doing this stuff, I went, Daniel, wake up, wake up. I just kept thinking, keep him awake. He's just, you know, he's only been at his job 4 months. He's really enjoying it. Now this.
Neurosurgery specialist on duty, Dr. Roy Chowdhury, has come to assess CT scans taken at Colchester.
Can you feel your buttocks? Can you clench your buttocks? Can you feel your genital? Do you want to touch your? Shall I just let me just get the pen?
I don't mind, you can grab my nuts if you want.
Right, I do need to check. So I'm just going to touch them on your leg. Yeah, could you feel that?
No.
You couldn't feel that? No. And if I just touch onto your genitals there?
The extent of the injury is very significant here. His spine basically shattered, and in the process it's damaged the lower part of the spinal cord and the nerves going into his legs. And you can kind of just appreciate these blocks here of the spine, and then suddenly you notice this one, which should be sitting right under here, is all the way back here, and the nerves behind them are getting almost certainly injured.
For a little while after the crash, I can move my legs and stuff, but
That's always a good sign. There's going to be some bruising and swelling around that bony injury. We'll get all the specialist opinions and we'll get back to you as soon as we've got some more
I've
information.
got walking and that's normal.
And it's too early to be thinking of things like that. Okay?
Daniel's cousin Stuart is brought in from Colchester an hour after him. Daniel was taking Stuart to B&Q when they crashed.
Families travel in cars together. You know, if one's injured, then it would be nice if none of the others were, but actually... Okay. Okay, so can we get a hand over?
His main complaint for pain has been his left hip, left ankle more than anything else.
Ready, steady, go.
Keep your hands still, okay?
He's got some significant pelvic trauma, as we can see from the position of his leg.
Chris Lawrence, the orthopaedic specialist on duty, has been called to assess Stuart's bone injuries.
And then he's got a dislocation of the hip, which we need to do something about. I need to see the images first. Yep, where was it? Just crashed it. This is the socket for the hip, and this is the ball. This ball is supposed to be present in the socket. So the difficulty is he's got this dislocation of his hip, which we need to get back in joint to improve the blood supply to the ball as soon as we feasibly can.
Chris wants to put Stuart's hip back into place in the emergency department, but it's a painful procedure, and Ali's concerned she can't give the pain relief he'll need.
I need to try and put his leg into a better position.
I realise that.
Can I try it on the internox if I can't have anything else?
Do you actually think, I think that would be torturing this gentleman.
Given the urgency, Chris is prepared to try gas and air, a mild pain relief.
His leg's in a position that is unacceptable. We need to put it into a position that's acceptable.
I've never seen a posterior hip dislocation go back in, no matter what it's associated with, without sedation. I have to be honest.
No, but that's because you always give it. You never do it without, isn't it?
Yes, but that's because it's mean. There needs to be somebody maintaining an overall view for what is best for the patient. And I think that as a trauma team leader, that's something that is within our responsibilities.
Ali arranges for Stuart to go to the 24-hour trauma theatre. It takes a few precious minutes, but he'll be given a general anaesthetic in the safest environment.
Are you allergic to anything?
So what we're going to do with Stuart now is we're going to try and pull his hip joint back into joint. This is the socket. There's the head of the femur. That needs to be back in there. It's very tricky. The cup is fractured, the hip's dislocated, and that side of the pelvis is unstable because that's fractured as well. So we're going to have to do this quite carefully.
Show me a picture there. And again.
Oh, that sounds good.
Picture, please. Okay. Went back in with quite a clunk, so we know that it's gone back in. This is certainly just the start. This is an emergency procedure that we need to perform to get his hip back into joint. At least we bought some time there.
Are you okay?
Yep.
Hold strong. Sit down.
No, I'm better standing.
In the emergency department, Roy Chowdhury wants to get the driver, Daniel, to surgery as soon as possible to release the pressure on his spinal cord.
So the main aim of the surgery is twofold. One is to fix the spine because obviously you're in excruciating pain. The other main reason for doing it is to try and take the pressure off your nerves to give them the best chance of recovery. I'll be very honest with you, this is a serious injury. There is a significant risk of you having long-term problems with the nerves. I cannot say now, there's no one who can predict that.
Way,
As in,
as I can't walk.
that's a possibility. But I cannot say that for certain until we've done the surgery and we've given you time to heal.
You've got to just do one step at a time.
Is it more like I would be able to walk in time or not?
It's very difficult to call it right now. So we need to fix it first. We need to fix it first and then see recovery, okay? I know I'm giving you a lot of information. What else do you want to ask me?
Pretty much covered all. Really, just scared really,
No, I can imagine.
As dawn breaks, Daniel's taken to the neurocritical care unit to gain strength before they operate on his spine. His cousin Stuart's also here as he comes round from his hip procedure.
I was meant to be moving house today. So it would have been nice to just settle in my new house. I take it I'll be in it probably for another week. So it'll just be my cousin now, Daniel. I've heard there's a 90% chance that he might not walk again. So I have to deal with that, you know.